My name is Amanda Holleran, and I'm an orthopedic foot and ankle surgeon. I always wanted to be a doctor, and when I got to medical school, I started to do orthopedics, and it really was carpentry of people and building something, changing the alignment, just like I do in the foot and ankle. You know, you really can make a huge change in someone's life by changing their alignment and how they walk. And so the foot and ankle can be, pretty complicated in a lot of ways, but I think that, the aspect of a foundation, a good foundation, is something that resonated with me, and so I love giving people a good foundation. So I treat almost everything in the foot and ankle, anything from bunions, which I'm starting to do minimally invasive, and hammertoes, to midfoot arthritis, to flat foot deformities, high arches, any sort of deformity really in the foot or ankle. I also treat ankle arthritis, sports injuries, ankle instability. I'm very interested in the minimally invasive techniques and doing things a little more minimally invasive in foot and ankle surgery. So I think what differentiates us is not only are you getting the team, a great team of people who are here to take care of you, but we're also really interested in doing research, and we're all interested in staying on the forefront of medicine and what's new, what's upcoming, not only what's new, but what's best. And so I think that that's really important. So I think that's what differentiates us. I think I'd like my patients to know that I want to make you better, and we'll work together to figure out whatever the best route of making that happen is. So whether that be surgery or not surgery, I'm here to help figure out what's going on and try to get you to a spot where you want to be. Surgery isn't always the best option. I think the first line of treatment is always non-operative treatments, and so we have orthotists that we work closely with to address a range of pathologies, as well as foot and ankle physical therapists specifically who will address various pathologies in the foot and ankle. All of my patients get my full and undivided attention, and I want to see them through to the other side no matter what happens. I love foot and ankle because you can correct a lot of deformity and make a true difference in someone's life. I also love orthopedics because, again, most of my patients aren't sick. For the most part, they're healthy people who want to live a healthy, active life, and I love getting people back to their activities and doing what they like to do. That's my goal.